I'm with the and here for PXP, I'm really excited. I'm a P4 at the University of North Carolina, getting ready to graduate. Let's see. And I think Joe might have hopped. Well, Joe's here, but I can speak for him. So Joe is a fourth year from Howard University, and he would say the real HU. And he is also representing the Pharma Collective, and he will be going to CJ next year for a fellowship. And then we have our last member of the Pharma Collective, Matt. Did you want to say hi?
Yeah, so sorry that I'm jumping on and off. There's like a hailstorm here in Houston. I don't know who's in Houston on the call, but yeah, that just knocked my internet off. But yes, fourth year pharmacy student here at Texas Southern University, heading to Takeda next year on a U.S. Field Medical Affairs Fellowship. And I'm so glad to have everybody here tonight.
Awesome. And I'm George Operman, also from the Texas Southern University College of Pharmacy. I'm currently at the University of Michigan right now, though. I'm here as a co-founder of Pills and excited to have this topic here with Dr. Onwoo and Worku.
Awesome. Oh, yes.
Hey everybody, I'm Josh Blackwell. I am one of the co-founders of Pills and happy to be here. It's an exciting topic and happy to partner with the Pharma Collective. So looking forward to a great discussion this evening.
Most definitely. So we're really excited. I'm really glad that we were able to get introductions with everyone. We will go ahead and get started and introduce our lovely esteemed speakers today. And then I will pass it off to George to give another introduction, and then we'll go ahead and get started and answer questions. I want to make sure that you all know that we do have some prepared questions and some questions that you all sent in. But if there is anything that you would like to know, you can feel free to raise your hand in the middle of the conversation, or also put them down in the chat so that we can incorporate and answer any questions that you may have as well. So first, I will introduce Dr. Crystal Onwoo. Crystal graduated from Duquesne University in May of 2020 and began a medical affairs fellowship at a digital health startup, Omada Health. After 8 months, Crystal transitioned to the clinical strategy team and now works closely with commercial, marketing, and product teams to simplify clinical information and develop clinical assets. And now I will introduce Dr. Elizabeth Worku. Elizabeth is a clinical operations specialist at Wheel, a digital health company dedicated to putting great care within everyone's reach through virtual health. Her dynamic role at Wheel has allowed her to embark on a wide array of focuses, including quality assurance, client discovery and sales, data analytics, and EMR development. Since receiving her PharmD at the University of Maryland School of Pharmacy in 2021, she is fully dedicated her career to optimizing patient care through the fusion of health and technology. Super excited to have you both. Let's give them a virtual round of applause. And with that, I will pass it on to George.
I'm gonna give them a real round of applause because y'all can hear my hand. So also happy to have such Black excellence in front of us. I know Women's History Month is over, but we always celebrating women, always celebrating Black. So I wanted to start off with that. So we have people sliding in our DMs, and because I'm a professional, I don't have to say the doctor. I'll say Crystal and Elizabeth. Like, people were asking, what I'm hearing strategy, I'm hearing operations. What exactly is health tech? And I know both of you might have different answers, and that's the point of this. We want to be able to understand what that is. So Crystal, because your name starts with a C, I'll start with you, and then definitely hop it off to Elizabeth to share her thoughts on what exactly is health tech.
Yeah, so when Matthew came to the session, I was like, I cannot be the only one to talk about health tech. Like, health tech is so new and so broad and it's ever changing. And I felt it wouldn't be right necessarily to just have me on here. So I'm definitely happy to have Elizabeth also speak to her part of health tech, because it's also very different than what I do. But really in general, health tech is a relatively new part of healthcare delivery. So usually you would have your programs delivered in person. Now for my company, we're a digital delivery company. So consider like telemedicine or digital therapeutics. We deliver care through an app. So that's what health tech is to us. We're a health technology company. So you're a tech company first, the same way you'd have fintech, financial tech. the big tech companies like Netflix and those. But health tech is a company that's a technology company first, but also focuses in healthcare. So a little bit about what Omada does and what my company is focused on, and then Elizabeth, I'll pass it to you to define what health tech is to your company.
Yeah, so for me, the way I like to think of healthcare tech and also digital health is like an umbrella term. And so it kind of encapsulates any type of healthcare that's being delivered electronically or digitally. So the way I like to think about it is the different categories. You have apps. So it can be an app that simply you log your weight, you log your blood pressure. You also have your wearable devices. So something as simple as an Apple Watch or a glucose monitor patch. You also have the companies that Crystal has mentioned that deliver virtual care. So if you're on a call, seeing your PCP virtually over a Zoom call, that's also an element of digital health. And then the last one is also EMR. So the way we store our information, if it's electronically, that's also funneled under healthcare technology.
That's amazing. And so I love that I heard one, deliver care through an app. I also heard an umbrella term that healthcare delivered electronically. Obviously, both of you are in different roles, strategy and operations, if I were to just say it more broadly. So as you think of the people that are on the phone that are hearing this for the first time, what are some of the functional areas within, whether it's your company or the purview of where you have the care that you're able to do electronically?
Yeah, I can go for it. So for me, I think it's important to note that my company is a startup and it's very exciting because we have our hands into everything. Right now, our focus is building out and we are like moving like a rocket ship. And so I guess if I was to kind of focus in on certain things, my role kind of started off on clinical operations, meaning making sure that clinically the way we're conducting our business is sound. And so that first started off with quality assurance. And so I was setting up and also auditing our clinicians on our platform. So making sure as they're taking these consults, they're prescribing appropriately, they are referring out appropriately. So there's like that quality element. And then there's also a different direction that we're looking to go to is that platform development. And so not only are we supplying clinicians, but we're also trying to offer clients platforms that they can use through us. And so we're building out intake questions, helping engineers. Like I'm typically the clinical voice. So like she says, our companies are technical companies first. And so someone needs to be present to make sure that like clinically things are aligned. And so that's also an element. So I would say quality assurance and then also like EMR development is a focus for my company and my team and role.
Right. That's a great point you made, Elizabeth. Like kind of piggybacking off of what I said about how our companies are technical companies first, as in there is no other clinician there besides Elizabeth and maybe a few other people, because they have the engineers, they have HR, they have their sales team. That's what makes up a tech company, is building the actual technological product. And then if it's a health tech company, now you have clinicians who are there to do quality assurance, make sure they're saying the right things. So clinical is almost seen as an accessory, almost like they'll have their research team first and then they'll build out from there. So the way it's done is very different than how you would see it in pharma, where you talk about functional areas and you have pharmacists pretty much everywhere, or you'll have clinicians kind of in clinical dev, medical affairs. And then later on, it became like commercial, other areas that you wouldn't necessarily have seen a pharmacist, but of course it's beneficial in those spaces. So in my company, I actually have a very medical affairs type role, but like Elizabeth said, I also work at a startup. It is a 12-year-old startup, so it's not really a startup, but we haven't IPO'd yet. So as far as we're all concerned, it's still a startup. We're still privately funded. And so we kind of do many people's jobs, right? You wouldn't really see this in a pharmaceutical industry sense, but I do the creating of the decks. I join sales calls. That's almost like a sales engineer's role in a tech way, or you can say that an MSL role in a pharma way. So I join the sales conversation primarily because the person that's speaking to the clinician on the other side is a salesperson. So they're not really too familiar with everything our product has to offer. They can't really talk and speak off script, right? This is almost like giving you like a pharmaceutical sales rep vibe. So I'll join the call as the clinician to provide more information, to dig a little deeper into the research, to talk a little bit more about GLP-1s and the fiasco that's going on in healthcare. Like that affects us too, because a lot of our clients are insurance companies and things of that nature. And so that's the other part of my job. I also work with marketing to review all the brand assets to make sure that what they're putting through PRT, PRC, whatever you call it in your company, is basically promotional review committee, to ensure that whatever's going out externally, whether it's to the end user or the end viewer as a consumer, like a regular patient or a healthcare company, we want to make sure that it's clinically sound. So that's my version of quality assurance from a asset review. I would say yes, and another thing I do is sales training. So I mentioned that our salespeople are not clinicians; they're salespeople, but they do have to have a level of competency to join these calls because they're talking to healthcare professionals sometimes. And so I'll train them on this is the script. So I think it's also part of medical affairs in some companies' eyes. Long-winded way of saying I have a few jobs, and like kind of like Elizabeth.
I was gonna say sorry, I was gonna say your original question of like, what's the difference between operations and strategy? Much like digital health, it's all really umbrella terms where depending on the type of company you work for, you wear many hats. So I wouldn't even get too stuck on the actual end piece of the role title.
True.
Yeah, and so I love that that's the case, because I think unless you're listening very hard, you didn't even hear what companies y'all are representing. One, two, we obviously are pharmacists. We have pharmacists on the call. We have students on the call. So actually, I wanted to even take a further step back and foundational step back and say, how did y'all even get here? What is your career journey to even get you here? So I'll let either one of you go first before the next couple of questions I'll pass off to Tatiana to dig deep.
Well, I can jump first, considering mine was a little bit more traditional than Elizabeth, a little bit. So my company, I went through the fellowship process like everybody probably has been or will go on this call. And I didn't match in that sense. I didn't match with the company after last rounds. So I was on LinkedIn looking for like fellowships, because we all know that some fellowships come after the whole December season. And I heard I saw this company on LinkedIn called Omada, and they're looking for a medical affairs fellow. They didn't ask for a PharmD, they wanted an MD or a PhD or PhD, like all these research-based people. And I was like, well, let me just apply. I was applying to everything anyway. So I applied and got the role. It was but actually in that case, it was actually research. I was doing clinical research, studying the program for people who participate in our program. And so they were in the diabetes chronic condition management program, plus using an Abbott FreeStyle Libre CGM. And so my job was to help manage the agency that was doing this decentralized trial because we were in COVID. And so that was kind of like a shock because I didn't realize what I was getting myself into. But later on, this more medical affairs role opened up on a different team called clinical strategy. So that's kind of how I got into it. It was a one-time fellowship. They were looking for one person to just lead this study and finish it out. And I just ended up becoming a full-time employee.
I love that.
Yeah,
Elizabeth, you're more non-traditional way. What happened with this non-traditional?
Yeah, no, I always tell Crystal she has like an insane amount of luck. Like that, her story, I always like love hearing it because it just worked out exactly how it needed to. But I think for me, my journey kind of starts even before like pharmacy school. I think well before pharmacy school, I would say my freshman year of college, I was very set on the fact that I would be a pharmacist. I would follow a very straightforward path. No ifs, ands, or buts about it. I knew exactly what prereqs to take. I knew what school to go to. I was thinking about the fact that I've actually only applied to one school, which is actually very wild now that I look back at it, but that just kind of illustrates the fact that I was very dead set on like what my life was gonna look like. And then I would say P1, at the end of P1, I kind of realized as a pharmacist, you don't necessarily have to practice or use your license in kind of the traditional senses. So whether it was retail or residency, I realized I actually had some room to do something different. And so that kind of stemmed from the fact that like patient care is my favorite. I love it. One-on-one with the patient is like my favorite thing. But then I realized we can do what we're doing on a larger scale, and that was through technology for me. I also just had some comfortability with tech. I think I was that person during rotations tinkering with like the automated dispensing machines. Like it just kind of was my jam, I guess. And so I knew I had to figure out what I wanted to do. And so the traditional way, I guess, was thinking like direct routes from pharmacy to tech, and that's pharmacy informatics. So I was looking at residencies initially, and like Crystal mentioned, all of this is very new, this whole health tech space. And so pharmacy informatics programs at that time were very new. There were only like a handful across the entire country. And I spent some time talking to informatics pharmacists that actually went through programs to get their insights. And I ultimately realized that I still kind of wanted to go rogue a bit, which is not what I would have traditionally ever done. It was very scary, unlike anything that I ever decided to do. And so against my advisor's suggestions, they would always say like, hey, I think you should really apply to residencies. Like, are you sure about this? And they all meant well. But I was like, no, I'm just gonna go for it. I told myself I would just dedicate my first year out to just looking for jobs in a healthcare space. And if it happened, it happened. If it didn't, then I would just go back. And so once I graduated, I spent a few months just prepping for my boards. I think, you know, Crystal and I, it was important to still get our licenses just to have our opportunities kind of be there. But after I did that, I started applying through LinkedIn, connecting with other people, and I stumbled upon my company. And we can get into that a little bit more, but something that I found is, like you said, operations, strategy, it's all under very different titles. So it's a tricky game when you even go into LinkedIn. And so it was a lot of like just casting your net, and I ended up at Wheel ultimately.
Yeah, and Elizabeth came to me in her P4 year and was like, I'm not applying to fellowships. I'm not applying to residencies. Like, I want a tech job. And I was like, okay. But she was so dedicated, like there was dedication beyond anything I'd ever seen. And so, no, her getting her job at Wheel was really, really inspiring.
No, and I appreciate talking to you. I remember that call now. It was really special.
That's awesome.
I
That's
love that.
super exciting. And I love to hear how adventurous you both were. How did you even find out exactly what tech or informatics was? Did you have inspiration from someone? Did you take a class? Like, what was it?
I can go for it. Just kind of tailing off of what I just mentioned. I think for me, like I said, the first start was direct routes. That's just kind of easiest for us, right? Thinking, what can I do as a pharmacist? And I explored informatics. Like I mentioned, opportunities were kind of slim. And I just still kind of had this inkling of like, let's explore what else is out there. And so we joked about this earlier. I was one of those people who created a LinkedIn during my P4 year. I hear that people do that earlier, but at that time, a lot of students that I went to school with, we all thought like as clinicians, you didn't have to do that. Like you thought you could just take your classes, get your grades, take your exams, and you would land a job. But it's completely different, and it just opens up your network tremendously. And so outside of the residency, the next step for me was going on LinkedIn and just scouring. I would look up words like clinical operations, clinical tech, clinical data analytics. Like you have to get pretty creative. And so that's kind of how I ended up finding more opportunities, and then connecting with people like Crystal, who either looked like me or was doing what I wanted to do, and going from there.
Yeah. So when I first started, I didn't know any pharmacists in tech. I kind of accidentally landed in tech. I applied to this job, had no clue what a motto was. All I saw was diabetes, chronic condition, and pre-diabetes, something like that on the job listing. I was like, okay, cool, I can do that. Like that was literally all I knew. And I actually was forced to learn more about it when COVID hit. So I applied to the job in January, got it in February, and then by March, April, this thing called COVID hit, and then digital health was like the highest funded sector of private equity at the time. So it was like it was just a lot was happening, and I learned very quickly what digital health was. And I think about a year later, Elizabeth and I started connecting, or probably a few months later. And that's kind of how it had been. But when I first joined my company, I was the first pharmacist, and I'd only known one other pharmacist in digital health, and she worked at Grand Rounds, which is not called Included Health, but she was a patient-facing pharmacist. So still wasn't really what we do. It was more of a telemedicine type of role. So she was delivering pharmacy care through an app.
Awesome. That's so exciting. And I could really see how the pandemic probably made health tech even bigger than what it was in the beginning and gave it more visibility. So that's exciting. Elizabeth and Crystal, you both talked about the importance of LinkedIn and how it really helped you define your roles or secure your roles. I know in pharma, it's very similar to where one role for strategy can be a completely different term or title. So can you give any advice to students who are maybe looking for internships or fellowships or different opportunities, even in health tech, and how they can kind of cast a wide net and be strategic with what they're looking for?
Yeah, I can start. It is very much, I believe, what Elizabeth said. There aren't many, and I can speak for what I know, and Elizabeth can you definitely add. There aren't really any internships, appies, things of that nature in tech, considering it's so new. So if you were interested in tech, the biggest opportunity is applying straight on. You can definitely look for fellowships, like mine came out. I'm always looking for those. They're not very popular. They're mostly looking for postdocs, so people who have their PhD primarily. But searching for titles or like keywords like clinical strategy, clinical innovation, digital health, things like that, to kind of, and then connecting with people. I think that's a big thing. In pharma, there's a little bit of opportunity for you to not know someone and still get a job. In this situation, it may be a little easier to also just to know someone who's doing it, so they can refer you to a job. They can vouch to your experience, because a lot of people in these health tech companies do not know what we do. They see pharmacists and write you off because they're like, oh, you just dispense meds. Like we don't need that skill set. So I think that's a kind of a barrier too with pharmacists getting into the field. Another thing is, if you didn't really care to practice pharmacy, a lot of pharmacists get their PMP, their project management. I forgot what the last P stands for, but their project management certification to kind of do project management, scrub master type of work as well. So they basically diversify their skill set in that way.
Yeah, I think Crystal's insight is really special because of the fact that she was able to kind of keep her ears closer to the fellowship side. For me, I guess my biggest thing was just networking. So while you're on LinkedIn, not only are you finding these roles, like she mentioned, talking to people, because again, these titles are very vague. And so you can talk to someone and we can have the same exact title, but depending on the company, we're doing completely different things. And so it just gets your mind turning. I think it's fruitful because you can start to see like, hey, do I actually want to do this? Do I need to embark on analytics to like pursue this job at this specific company? And so my biggest thing would be to get on a call with someone just to understand what they do. And then once you start prepping your like CVs and resumes, you can kind of craft it and set it in a direction that's more clear.
That's awesome. I've heard that, well, I'm sure we've all heard that pharmacy is a small world, tech is a small world, and your network is your net worth. So I think you all definitely are showing that right now. Eham asked a great question. So do you have any experience or skill sets that you found to be helpful in preparing for you to be a competitive candidate for your positions?
Yeah, I can take that one. So it was an interesting one because I remember when I was on calls, that was always my question of like, hey, what skill, what program, what can I do to learn so I can, be competitive? And I tell you this now because it can be a little frustrating. A lot of times what I would hear is, I wish I could suggest something, but what you'll find is at that company, things are different. So for data management tools, for example, one company could be using Tableau, one could be using like Looker. And so as much as we, especially like, we're all pretty determined and follow paths and tick things off, it's kind of hard. And so what I would say is even just starting basic and pursuing things like Google Sheets, like that will always work anywhere. So from a skills perspective, in terms of like hard skills, that's one way. For me, I think the way I was able to get people's attention was During my rotations, I made it like a point to always do something related to informatics. Even though I didn't want to do an informatics rotation, I figured that was the closest thing I would get to tech. And so I spent time shadowing. I did projects where I was managing databases. And so stuff like that, I would showcase in my resume to show that I have data analytics skills. I'm able to work and process complex systems. And so that's some ways that we can go ahead and do that.
Yeah, that's a great point, because now it's applicable to your actual role. Yeah, so for mine, luckily, I think my APPEs really helped. So I did a medical affairs APPE at Gilead. Didn't really matter the functional area because it was an HIV prevention, but there were a lot of keywords: asset creation, PRC review, things that honestly, getting into the job, I don't even know exactly what I didn't have any research going in. So they weren't really looking at the research. They were looking at the skill sets I had, because when you're going to a startup, they have a lot of work and very little people. So they need a lot of people they need people who have many skill sets. So they knew that I wouldn't be in this research job for a long time. So they could possibly use me in clinical strategy. They could possibly use me somewhere else because of all these different experiences I had. I worked with the FDA and NAPI. So they were thinking of if we were to get regulated at some point, this girl has FDA experience. Like, even the person we hired on my team, she has URAC experience, which is an accreditation body. She had no actual skills, no specific skills for the role, but we knew that her experience with URAC would help us. So that's kind of how some tech companies think. It's when you have several things that you've done. It doesn't have to be like, you didn't have to do it for 6 months, just any experience. They're definitely looking for that. So I definitely think for my role specifically, there were a lot of things I was able to pull from my APPE rotations and translate them, so you make them translatable skills for your tech job.
Perfect. And G-Day also had another question. This one was for you, Dr. Onwu, as well. He was saying that his ears lit up whenever you mentioned decentralized trials, and he was wondering if you can just speak a little bit more to that.
Yeah. Well, during COVID, everyone was doing a decentralized trial. Anyone that had a trial going on, it had to decentralize. So basically, you weren't having people go to the lab anymore. They weren't coming to the hospital system to get their blood pressure taken. Everything had to be done at home. So we were sending lab kits. We were sending CGMs through mail, but we would still have healthcare professionals, because the CGMs we were using were pro CGMs, so the professional had to stick them on for you. So we were having professionals do that, but that wasn't part of Amada. We had to contract another agency to do that for us. So I was working with a lot of different agencies to make sure this trial was still going to go as planned. The protocol had to change. Oh, what are CGMs? Great question. So CGMs are continuous glucose monitors. They are primarily used for people with type 1 diabetes who have to really know their sugars throughout the day, because that's a life or death situation. But it's also very beneficial for people who have type 2 diabetes, but they're on multiple doses of injections or insulin throughout the day, because they also need to understand what their insulin levels are throughout the day to maintain a healthy level, if that makes sense. This CGM really helps to look at your blood glucose levels like a movie and not just as points on a chart, because it tracks your glucose 24 hours a day, as long as you scan it 3 times a day. And so it was really beneficial for us because we help support people with diabetes. But people don't stick their finger enough times for us to actually know what is going on with your blood glucose. So this CGM was super helpful because it didn't hurt. People could just use their phone and scan it, and we were getting 8 hours of data with just one scan. And so it was beneficial for us. It was beneficial for them because it was an education tool. And these are people who were not necessarily, I'm not going to say not indicated, but they weren't necessarily going to be covered by their own insurance provider because they were not on multiple daily doses of insulin. These are just general people with diabetes, but Omada provided 2 free CGMs at no charge so that we could get data, but also to provide education to these people with diabetes to let them know, like, hey, when we have this much data, we can help you much better, because now we can see how your food impacted your blood glucose, how your exercise impacted your glucose. So things like that. And that helps further the education. I forgot my main point, but yeah, decentralized trials. I think the idea is that you're kind of doing research in a very fragmented way that's not local. You're using a lot of different resources to kind of get the research done, if that makes sense.
Perfect. And then I have another question, but this time for Elizabeth, so that's perfect. And this was from Michael. He was saying that how you mentioned how your path is so different, and he was wondering if you felt any pressure being so close to ending school and not knowing exactly what you wanted to do.
For sure. Definitely. I think, again, with pharmacy, there are pretty straightforward paths and things that you can check off and you know what to apply to. And there was really no roadmap to this. And I remember just being on calls, kind of pitching like a concept. Like I knew the gist of what I wanted to do, but I could never put a name or role on it because at the time there just weren't many. And so that was definitely a little weary, trying to pitch things to people like as though, you know, you had it kind of figured out, but not being able to show an actual role was kind of difficult. But I guess if anyone ever has those kind of concerns, I would just say like stay the course, because things pop up. It's just, you have to just keep digging and networking and having conversations.
Love that. We love that. And so I think also we've had a question that was actually from Matt, but you've touched on it a little bit throughout. I know I work at Lilly, which is a bigger company. We do health tech stuff. You both work at startups. Could y'all share a little bit about the differences or nuances of working at a startup? And I'm saying this in the perspective of a student, so that as they're going through their opportunities, there's not a right or wrong, but just sharing your perspectives and skill sets that would make a student or even a professional that wants to pivot be successful in one area versus the other.
Yeah, I can go for that. So I should say when I kind of came across my company, I didn't even have like the intentions of like established versus startup. It just happened to be that they were a startup, but it was a very much a blessing in disguise, because you just work at a rate that's just like exponential and you learn so much. I always joke that like 1 year at a startup feels like dog years. It's like 7 years. And so I've only been there for like a year, but I could tell you everything you need to know about the company, which is just very, very rare. And so in terms of what students could do kind of to prepare for that, I would say your soft skills, like really asking yourself how you deal with flexibility, how you deal in kind of chaos. Like, is that something you thrive in? And it's kind of like a character trait type of thing. And I also would say like challenge yourself. Don't assume that because we come from very structured spaces that you won't thrive in it. You'd be very surprised. I think pharmacists do very well in chaos. And so you really are resilient and you can pivot. And so I would say being flexible. Are you in a space that you really are open to opportunities? I find myself in meetings and projects that I was not a part of on Monday, and now on Tuesday I'm, you know, leading a whole nother type of project. And so just asking yourself, like, are you interested in learning, being a sponge, being very humble to learning as well. I think something that's really big at startups is that no one has an ego. There's no room for it. Like, I work with doctors, nurses, engineers, and we all treat each other as equals. That's really, really important. So just more, I guess, soft skills, I would say.
+1. Yeah. all of that. Yes, like everyone in startup, at least in the health startup, I can't speak for like other fintech, you know, others more established companies, but in startup, everyone acknowledges they don't know what they're doing. And sometimes that can be very frustrating, because one day you're working on product A that you're supposed to commercialize, and then 2 months later, like, oh, scrapping that, we're doing something else. And you're like, I just did all this work. And so that is the agility that you're expected to have in a startup. There's also going to be ebbs and flows. So you may have heard the layoffs that have been going on in tech. And so some of us have lost our teams. You are still expected to perform. The expectation is that because the company is so small, you kind of feel this personal sense of obligation to your team. It's a very personal experience. When I was in research, we were a team of 3, pumping out like 5 research studies a year at least, because we're not a regulated company or a regulated sector. So you can pump out research without having to go through, I mean, you go through an IRB, but that's the most you go through. You're not really going through an FDA to release our products, nothing like that. It's still a tech company. And so you're able to move at this super fast pace. You don't have stakeholders because you're not public. So you're really just able to do whatever you want, as long as you're trying to get to a place of profitability, which is that IPO or selling your company. And so for sure, agility, for sure, having like can't think of the word right now, but basically having like a personality where you're going to do this for the betterment of your team. You're going to dedicate, you know, your time to making sure that the team gets ahead. It's really not like a one person for themselves environment. It's very much a team-based environment. Everyone in my company is still on a first name basis, and there's about 500 of us, but about 250 of us like not on the field, but in the company. And so I would definitely agree with everything Elizabeth said. And I think there's more to it. I mean, of course, just making sure that you don't necessarily have to, you can always try it and see if you don't like it, but I think it's kind of an addictive place to be in, because you're just, there's so much visibility too. Any work I do, the CEO sees it, all the way down to like an associate. Everybody sees it. So the visibility is impressive. My CMO, our chief medical officer, is my manager for like a year and a half. And we're talking about her kids every day. It's a very laid back environment, not necessarily dog eat dog, which is really great. I think sometimes when you're a student coming out and you're really trying to feel like you can fail and be comfortable doing so. Whereas a lot of established companies may not have that environment, depending on the team as well.
Love that. And I think we have another question, but before I go into there, because you were going to, I know this time period and this job and this role is not all peaches and cream. So just speak to a little bit of the challenges beyond some of the layoffs, but just like the challenges, whether it's in your role or your day-to-day or experiences, to give a little bit more color to those that might be entering.
Yeah, I can start. So I think the hardship is much like we said in reverse. So you're going to try to be comfortable with, taking one for the team and being very agile, but it's going to be hard. So when we had our layoffs in 2021, we also had the Great Resignation. And when you have a Great Resignation with a small team, a small company, it is basically everyone left. So I went from a team of 3 on research to a team of 2 in clinical strategy to now a team of 1 after 2 months. So I was working as a team of 1 for about 4 months, and I, mind you, just graduated from school about 8 months ago. I had no clue what clinical strategy was. There was no onboarding the way you would get it in like a pharma situation where there's like a whole handbook. That doesn't really exist in startups most of the time. And so I think that stress can be very overwhelming. Because we move at such a fast pace, we're selling, the world doesn't stop because there's a Great Resignation. So I think that's for everybody in the economy. So you were still selling, you were still joining those calls, you were learning on the job. I think it's a big thing about tech is everyone is learning on the job. And so, and it wasn't just me, other people were like, we got this, Crystal. Everyone was kind of starting a new role because everyone had to kind of take over responsibilities that were left behind from someone leaving. And so I think, again, that camaraderie, because you're working with all these different people, who you're on a first name basis with, it helps you get through that. Another thing is path to profitability. You're going to experience a lot of changes in a startup because you're going through different phases depending on how long you've been there. So I've been with them on about 3 years now. We started off as like having fun kind of company to now being really serious, very regimented, a lot of documentation. That shift was very drastic for me because I'm not used to that. And so I think that just speaks to you being flexible. But I think those are a few of the hardships that I experienced at my job.
Yeah, I would definitely echo those. I think those are definitely big pieces. And I think something that came to me, you mentioned the fact that, yes, as a startup, you are so close to people, they almost feel like your family. And so it's one thing when people transition out of roles. I also think like work-life balance is interesting. Personally, I work for a remote first company, and it has many benefits. Like, I won't sit here and complain at all. But it's interesting because I think for myself and just a lot of people on our team, we love to work, and we will work all through the night if needed. People work across all different coasts. And so it's hard to kind of step away the way you would if you clocked out at a 9 to 5. But again, that kind of just comes with the fact that like you just care so much. And also, you know, if you don't do it, it's kind of like who else is kind of doing it. So that's one thing. Another one, I wouldn't say it's a challenge, but I think a learning experience for me and like the other clinicians on our operations team. We're all clinicians, and so our gut is always like patient first, clinician first in everything that we do. But again, like Crystal mentioned earlier, this is a tech company, so you have to make room for other priorities as well. At the end of the day, like quality and safety is always going to be number one, but there's things like sales and engineering and tech builds that you have to kind of make room for. And so understanding that like your priorities are not always taking precedent is something that's been a learning opportunity.
Absolutely, I agree with that.
Love that. I see we got some questions rolling in, and even though this is not supposed to be about anything related to me, I do want to answer the question because I think it's related. So the question comes from Jide. So question for me, even though you misspelled my name twice, so I'll let you make it though. Yeah, if you had to choose one, which one would you be, a founder or a CEO? And I think that's important also because we have pharmacy students here, and why I'm going to delineate the question because my answer would be founder, because I think traditionally when I even answer the question, someone would think of founder of a healthcare, health tech company. I think for me, I'm personally a creative, and my whole passion of making sure pharmacists or other healthcare professionals, which is why I love this panel. They're thinking to do things that are non-traditional and create and produce the things that don't exist. While you can technically be a founder and a CEO, I will peg the CEO in terms of being a CEO of an already established company or a CEO of a Fortune 500 company, which means when you do that, when you're a CEO, you're running something that already exists. You have investors, you have stakeholders, you have to produce returns. And so in doing that, the way that I like to work or my style, I like to create and own and be able to, if I want to pivot left or right, if I have the right stakeholders, they're not dependent upon like me making money or me having a pipeline, which is what I've kind of heard a little bit in both Crystal and Elizabeth's role, which is the only reason why I answered it. Because I think that's an amazing question in terms of what we're talking about today. Like pharmacists and pharmacy students, a lot of the questions that we're continuing to hear, which I think are awesome and amazing, I still want to continue to open your mind and your aperture. I think Crystal said it earlier in terms of your learning agility. You went to pharmacy school, and some of you already heard this a million times, to not just be a pharmacist, but to be a healthcare practitioner and or impact people. Like it might not even be in healthcare, it might be in building an app that impacts people. And so if you think of your ability to, everyone that started this conversation had a test that they didn't know nothing about earlier this week or last week, and now y'all are experts in. You can do the same thing getting into a brand new company, and whether that company's in healthcare, health tech, or that company's in something else. So I'm ecstatic to have two ladies who have not just and are continuing to live in that. They both did it in two different ways. And so if you take nothing else from this conversation, not just from professionals and student organizations per se, or organizations working on students. So one, you can have two different organizations that work together to bring this to you. But then you can actually be in two different companies, be a founder or a CEO, and then do things non-traditionally. So that's an amazing question, and it allowed me to also amplify the amazing work that Crystal and Elizabeth are doing, which, because we have 5 minutes, I'll pivot to you both to your last questions. So because of your, at least for me, we'll see what the crowd says, because you're so rigorously pushed on your startup and you are creating waves and doing new things, what do you all do for self-care? How do you take care of yourself? How do you prioritize that? I think as students, we probably don't do the best job in doing that. And so as professionals, definitely want to be able to have y'all showcase how y'all do that on a day-to-day or week-to-week or month-to-month.
Well, thank you for asking, first of all. Very I think that's always a work in progress, but for me, I think something that I did in pharmacy school and I still do now is definitely going to the gym. It's funny because I think all of my people on my clinical operations team, we're all pretty wired. And so we all go to the gym. Some of them get up very, very early in the morning to get it done. After work, they'll do it in the middle of their job. So that's probably my go-to. And then just being outside. So like taking hikes and stuff like that. Now that the weather is getting nice, I'm able to do that.
Oh, outside, not outside, outside. Okay, just outside, not outside, but outside.
Not
Okay, I just wanted
outside, no.
okay.
The stamina
That's
is
how you
not.
know you're outside. You say it twice. When you say outside, you know. That's
Yeah,
when you
no,
know.
the stamina isn't there anymore, unfortunately. I can't.
For me, it's different. I think my company is very big on work-life balance. So we had, during COVID, it's about to end, unfortunately, but we had mental wellness days every month. So every month you got a day off, your pick which day, and you can take it off. We also have a limited PTO. So I take my limited PTO. Like I take my good 6 weeks off a year, if not more. And I think it speaks to just their understanding of you work pretty hard in your job. And so, and I believe Elizabeth, you also have unlimited PTO, if I'm not correct.
Yeah.
So up to you if you want to take it off or not, but it's definitely something that I take off, and that's how I maintain my work-life balance. And I'm going to Barbados and Puerto Rico for 2 weeks. So that's already an example of how I do my PTO.
That's outside. That's outside.
Yeah, that's outside.
That's awesome. And I think as pharmacy students too, we're always all about that like workhorse mentality. So I love that as a P4, you guys kind of said like, take the time off, take that PTO, take those days off from rotation, put that laptop down when you need to. So I hope you P3s who are getting ready to go into rotations are listening to that. We had a couple of more questions too. So one question, about opportunities for career advancement. Are there any opportunities that you know of for pharmacists right now in the sphere of health tech to progress throughout their career? And if so, like what positions do you have in mind?
Could you ask that question one more time? I think I missed.
Yeah, sorry. What opportunities are there for career advancement within health tech?
Oh, okay. I can speak from, because it's a startup, you can literally jump ship. You could jump to a different team and just like after working with, say you did a project or two with the product team, product operations. So now your job is to make sure that whatever the engineers, design teams are creating, they're creating it, they're working cross-function with other teams. So making sure that it's clinically correct and it has all the things that clinical would like to see. It meets the business objectives. That's kind of what product operations does. You could do a few projects with them and say, hey, I want to join product ops and join product ops. So sometimes it's not always going up, but you can actually jump to a whole different team if you're interested. So for my company, there's a lot of flexibility there.
And then also to answer your question, I think from a student perspective, again, and if you're trying to just kind of break in, I would say definitely, again, if you have time in your rotations, if it's a priority for you to pursue this, making time for it, even if you're taking a very traditional rotation, just speaking with your preceptor and saying, hey, this is what I'm interested in, and just shadowing, that is something that you can automatically just start pulling into your CV. So from a student perspective, if you're looking to break in, advance, I say just get creative, shadow, and just take up any kind of project that's even remotely related to informatics or tech. And then if you're already a professional in the space, I would just say, like, think more about what you're doing and what can be translated. Something as basic as like data analytics. If you're running reports in your job in any way, that is like amazing. That is something that can be used anywhere. And so that gets your foot in the door. You may be doing an entry-level job, a data analytics job, something that you may not have thought automatically. But then from there you grow. And like Crystal said, you can jump from teams. Startups are interesting, or just tech in general. Roles are being made up every single day in a good way. And so you can be sitting here right now, and in a year, there's 5 more different roles that you can pursue. So I wouldn't get stuck on like, how am I building my career ladder? The roles will be there for sure. Just being open and being creative at this time, I would say.
Wow, that is so exciting. I don't know about y'all, but I feel so super inspired after hearing this and knowing that there really is no glass ceiling in health tech. It's really the sky is the limit. So with that, I think Brittany asked a really great question for us to close off with, and that is, what resources or different opportunities to continue to learn about health tech are there? I think she mentioned potentially Afrotech, but if there are any other opportunities that are focused more on health information as well that you may know of.
Yeah, I'm not as close or in tune with conferences, but I would definitely say there's really cool websites that are not directly, I guess, pharmacy related or even health related. One of my favorite websites was called builtin.com. And so that's more, I guess, related to jobs, but that kind of just shows you, again, some of the roles that you can start forming your CV around. Another thing that comes to mind is the HIMSS org. I think it's like healthcare information management system society. It's like a mouthful, but they always have things going on. They have courses, they have events, they have communities that you can join, and it's not just pharmacy related, it's like health informatics everywhere. And I think they have it across the region. So like they can have it on the East Coast, Central, West Coast. So I would definitely recommend exploring that as well.
Yeah, I'm like Googling, so I want to make sure. I know there's a few conferences that we go to. The weird thing with my company is that we're a B2B2C company. And actually, I don't know about yours, Elizabeth, in terms of how you market yourselves. But because Omada is business to business, we sell only to businesses. So you'll only see us at conferences that usually you'd see benefits buyers at, because those are our buyers. So we go to the, I would say one conference is DIME, which is the Digital Medicine Society. They may not have conferences, but at least they're a website to go to. They do a lot of work with digital medicine. So that kind of encompasses health tech and other like telemedicine companies. And then we typically go to the health conference, which is HLTH. May not be as applicable to you as a pharmacy student, but I believe that's where we would typically go for like other people in the space who work in tech, specifically health tech. So I would focus on DIME. We actually do work with the American Diabetes Association because my company still works in diabetes and hypertension and pre-diabetes. You'll still see us at AMA and ADA conferences, just not as large of a presence, but we're definitely there.
Thank y'all so much. And we always love to stick to our time. But I will ask one more question, Nancy. I did not miss you. You asked 2 questions, so I will ask your second question in there. And I think that's a good closing out for us anyways. And Nancy's last question. And of course, if you have any other questions, if it's okay with you guys, Crystal and Elizabeth, you can share your contact for any of our audience members to kind of reach out to you to because they did talk about LinkedIn. So that is a great source to go ahead and communicate. But going back to Nancy's question, how do you see digital health changing the way that healthcare is being provided?
Yeah, I think, and I felt this way when I was in school, I think it's inevitable. And it's not a bad thing at all. I think it's an exciting thing and an incentive and motivation for us to kind of start now. It is still very much in the early stages. So I say get in where you fit in and just start exploring. I think it's just in general, automation, AI is something that's affecting every sector at this point. It's not just like healthcare. And so it's just a matter of when and yeah. And so I would say kind of prepare for that and just start keeping your ears out. If there's something that you're doing right now that you feel like you can potentially do in a healthcare space, in a health tech company, I would definitely say explore that.
Yeah. And can you hear me? Because I know my voice is, my internet is kind of cracking. Okay, great. And the question, what did you answer? My mind is so spacey today. I'm sorry.
No worries. The question was, where do we think digital health is going?
Yeah, I definitely agree with what Elizabeth said. I think for our company, we exist because we recognize that primary care is we have less providers who work in primary care, and the amount of time they're able to spend with each patient is just not enough. They're not getting paid to meet with you for more than 20 minutes, and they're expected to kind of keep up the pace. So someone just gets diagnosed with diabetes in this 15-minute visit, they're told, here's a pamphlet, let's talk about it in the next 3 months. Well, they're not really familiar with what are they supposed to do from there? They may have been told about a diabetes prevention program or join this ADCES program, but they're not sure exactly how to do so. And so Omada, we call ourselves, we say that we're here to not break healthcare, but connect healthcare, something like that with marketing. But basically, we're here to be, to help patients in this space between doctor's visits. So they have their doctor's visit probably once every 3 months, maybe once every 6 months. Well, you actually have a coach and a specialist in your pocket who you can ask questions about your diabetes, ask questions about weight loss, nutrition, sleep, stress. These people are nurses or registered dietitians who are able to answer these questions where you otherwise wouldn't have it. And so I definitely see healthcare or digital healthcare finding its way to also fit into traditional healthcare as well, as we're currently doing with PBMs and payers and employers alike. So I think everyone acknowledges healthcare spend is going up. Primary care is just not going to survive at the pace that we're going at. We need things to be able to fill in space, fill in the gaps.
Thank y'all so much. Really just thank y'all for joining us tonight. You guys said a lot of great things. And of course, thank you for the audience. You guys could have definitely been anywhere else and you guys chose to be here tonight. And so with that, we're gonna go ahead and let you guys kind of end here. But again, Dr. Onwu and Dr. Okoro, we appreciate y'all so much for taking time out and just kind of dropping some much needed gems about the digital tech space. So with that, thank y'all so much and everybody enjoy y'all's night.